This is TVC Breakfast, the Friday edition. I am Kemi Folade with Ibrahim Shita.
Good to see you.
Good to see you.
Thank God it's Friday. It's today Friday, actually.
Today is Friday, but I want you to finish that statement. Thank God it's Friday. So
you'll still be here tomorrow, and I'll be here later in the day.
I shouldn't have spooked you. I wanted you to finish the statement. All right. So it's a fabulous Friday. Don't mind me. Thank God it's Friday, and we're beginning the show today on a hopeful note, and I sincerely hope that it means much more than hope, but it's a positive note, and that's about Seyi Tinubu. He's the son of President Bola Ahmed Tinubu, who has now gone on to launch an initiative that will benefit no fewer than 600,000 indigent patients on a monthly basis. Now, this initiative is targeted at reducing the country's infant and maternal mortality statistics. Now, this project is tagged Drug Banks for Indigent Patients in Obstetrics and Gynecology, as well as Pediatric Pharmacy Intervention. It was launched by Mr. Tinubu on Thursday at the Ahmadu Bello University Teaching Hospital, Shika-Zaria in Kaduna State. According to his representative, Ojeje Onimisi, the project is going to be expanded in the areas of medical equipment as well as research to revolve around infants and maternal health care. It will also reach 10,000 beneficiaries across 60 tertiary health institutions across Nigeria a month. And this is a cheering note. And as said earlier on, 600,000 patients, mothers, children, women, even the girl child, are said to be targeted under this initiative. 10,000 beneficiaries across 60 tertiary health institutions. That's about 600,000 in number of people that will benefit from this, and it has taken off and will spread across the country. It will also eventually trickle down across secondary and primary healthcare institutions, general hospitals, primary healthcare centers will also benefit in due course. But it's a good start. Yeah,
it's also a reprieve for those who are not having the opportunity to be able to bear the cost of the hospital bills and all of that, and those who are not even having good facility or having the access to getting to quality healthcare service. So according to some of the statistics that they actually read out, which he found alarming, they said that in 2023, Nigeria recorded an infant mortality rate of 54.74 deaths per 1,000 live births, while the maternal mortality rate in 2020 stood at 1,047 deaths per 100,000 live births. So let's see, he's actually more of a philanthropist. Most of the things that he does, a lot of people who are related to him one way or the other, either directly or indirectly, they've got good things to say about him. And so this definitely must be coming from someone, not just because he's a son of the president, because before the president even became the president, he had always been that person who helps a lot of people. I've never met him in person, but you get to hear stories about what someone like him has done, his family has done to the Nigerian people and all of that. But a lot of people will be asking, in what capacity would you be doing that? Are you doing that as a son of the president, or are you doing that as Seyi Tinubu? But this is very clear that he, as a person, is doing this to helping a lot of Nigerians, especially those who are having to face this scourge of maternal mortality and infant mortality.
Yes,
the rate which we record.
Absolutely, and it's a very laudable project. Mm-hmm. It's also ambitious because when you look at the sheer number of persons that are to be targeted, we all know the effect or the impact, especially the financial impact. In the course of our conversation, anyway, we know the financial strain. That's that just basic like pregnancy and all of that. We know how that will impact on somebody who is not benefiting or who doesn't have a regular source of income. We know how that, and governments of the day have been trying in that aspect alone, to ensure free healthcare services for pregnant women, for the aged and all of that.
That's right.
But now to target 600,000, you know, as a private individual, or you could say as a businessman, as a philanthropist, and all of that. Yes, of course, you can't avoid the fact that he's the president's son, but of course you also must...
He's also a human.
He's also a human being, and he is also, he's running businesses. He's a businessman. So that has to be taken into a whole lot more context than the narrow description of being a president's son. And just before you come in, I know that you also have you know, another thing to add. I also wanted to say that it's health. You know, the fact that he's even targeting health is also another commendable aspect of this project.
That's right. And, you know, something like this, it won't be doing it alone. It will also be doing it in collaboration with
partners.
International.
Absolutely. We understand that the coordinator of the project, a medical doctor, it has been, you know, speaking of this. He doesn't have to be there physically. That's Seyi Tinubu. But as you have said, you know, people will definitely be part of this team. It's going to be a whole, you know, wholesome project that will involve a lot of money and, yes, a lot of dedicated hands.
And this will also serve as a measure to helping to mitigate the impact of the increase in price of medicines, you know, drugs and all of that people can't have. I know the presidency has actually, you know, tried to, you know, mitigate against bring up some policies that would help to mitigate this impact of you know, price of, you know, drugs and all of that for people who are seeking medical aids here and there.
Right, and we're also hoping, you know, for more aids in this point now, at the time where international donors, there's said to be a donor fatigue, and, you know, it's also gratifying that even here at home, we also have such philanthropist, you know, gestures.